Hi, my name is Judy Fitzgerald, and for the past 10 years, since my own breast cancer diagnosis, I've been an active advocate for a preventive vaccine that was being developed at the Lerner Research Institute in Cleveland, Ohio. Thankfully, 4 years ago, in 2017, Dr. Vincent Tuohy received a grant from the federal government to take this vaccine from bench to bedside. With the money for the phase 1 clinical trial, we will soon be testing this vaccine in women. A sad note that I discovered about triple-negative breast cancer is that Black and brown women have a 30% higher rate of this most lethal form of breast cancer. There are many studies going on, which I'll explain in this video, but together, let's explore what we do know about triple-negative breast cancer and Black and brown women.
Thank you for joining me today. On my channel, we discuss all things breast cancer. I've become a passionate advocate since my diagnosis 10 years ago, and I am now advocating for women who cannot advocate for themselves. I currently serve as a breast cancer advocate on the clinical trial for a breast cancer vaccine, which will be announced soon. But meanwhile, a lot of my work has focused with women with triple-negative breast cancer. I myself was not diagnosed with triple-negative breast cancer, but in my research, I have found that I want to use the expression, is breast cancer colorblind? And I use this expression in a way because in my advocacy work, I have discovered that unfortunately that Black and brown women, women of African American descent or Latino descent, have a 30% higher rate of being diagnosed with the most lethal form of breast cancer we call triple-negative breast cancer. So it's more important for these women to be aware of things they can do to prevent themselves from succumbing to the disease. Some of them are lifestyle changes, but some of them are being looked at for genetic predispositions. We have long known about the BRCA1 and BRCA2 genes, which are very common in the Ashkenazi Jewish community, but there is still much unknown about why Black and brown women have some genetic predisposition to the disease, specifically the disease we call triple-negative breast cancer. So if you're not familiar with triple-negative breast cancer, as my 5th grade teaching experience has brought me, I'm going to sort of give you an analogy that I actually found on the CDC website. So, breast cancer has 3 receptors: estrogen, progesterone, and the HER2 or HER2 receptor. These receptors are the key to how breast cancer is treated. So let's look at this in a very simple way. So the CDC website simplifies the idea of the receptors on the breast cancer cell by comparing the cell to a house. And this house has 3 locks. The first lock is the estrogen receptor. The second lock is the progesterone receptor. And the third lock is called the HER2 or the HER2 receptor. So if your cancer cell or your house has these locks, and doctors have these keys, you can be treated with chemotherapy and then later on with adjuvant therapy of tamoxifen or Femara. With early stage ER-positive breast cancer, you can actually have a good chance of lumpectomy versus mastectomy, followed by radiation, and then followed by adjuvant therapy, treated with tamoxifen or Femara. We all know now that the HER2 or HER2 positive cancers can be successfully treated with Herceptin, where formerly they were pretty much a lethal prognosis. But what if your cancer has none of these locks? What if your cancer does not respond to estrogen or progesterone or have the HER2 gene, so you're not going to respond to Herceptin? Then what? Well, you'd be treated with the most aggressive chemotherapy and radiation, although many times women might opt for mastectomy in this case because it's an aggressive cancer. But then when treatment is over, there's no adjuvant therapy, there's no tamoxifen, and there's no Femara. And sadly, triple-negative breast cancer has the highest rate of recurrence within the first 5 years of diagnosis. So what about other factors that contribute to a less than favorable outcome for women of color? Well, racial disparities in triple-negative breast cancer. There's an article published in PubMed in 2020, and I'll leave the article reference in the notes on my post. And it could be economic, it could be diet and lifestyle, and the unfortunate thing as well is that Black and brown women have a higher rate of getting breast cancer in their younger years, between the ages of 40 and 50, and also in their 30s. And it's typical that when women get breast cancer earlier in life, these cancers tend to be more aggressive. So what's the answer? Education is so important. Early detection, being aware of women that are higher risk for the disease, and more access to health care. So please check out my website, www.sistersforprevention.com. We'll soon be looking at clinical trials that will help women, Black and brown women, diagnosed with this disease, achieve longevity like their white counterparts. Thank you for watching. Please subscribe to my channel. It helps us out tremendously with all of our education that we like to do. It doesn't cost anything, and it really means the world to us. And please also check out my website, www.sisters4prevention.com, for the latest news on all things breast cancer. And thank you for watching. Till next time, stay safe, stay healthy, and may God bless and keep you safe. Thank you so much.